The coronavirus and what it means for you. That's the topic of the day. Stay tuned to learn more. Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. Welcome to my channel, your number one source for information on orthopedics and sports medicine that's easy to understand for everybody. If you want to know more about my life as an orthopedic surgeon, be sure to follow me on Instagram or Twitter at Stable Knees. I'm also on TikTok at Dr. Raynor. If you're looking for workouts, exercises, or information on injury prevention, be sure to follow us on our sister channel here on YouTube, Human 2.0. While I am not a specialist in infectious diseases, I, like everyone else, have been forced to reevaluate my everyday life as a result of the coronavirus and the COVID-19 pandemic. Yes, it has now been titled a pandemic. First, I must admit that I was resistant because this is not my area of expertise. However, I have sought out answers for many of your questions, not only for you, but also for myself. I have decided to share this information with you with the hope that I can provide some real answers to all of you who have been searching for them, and to hopefully ease some of your fears and concerns with the problems that we are currently facing. All of the information that I present in this video can be found on either the CDC or the World Health Organization website. I'll leave a link to those pages in the description down below. The more people that have this information, the better. And the more likely we will be able to defeat the virus and get back to our lives. With that being said, hit the notification button and let's get to the topic of the day. So what is the coronavirus? Coronaviruses are a large family of viruses that cause illnesses that range from the common cold to more severe illnesses, such as the Middle East Respiratory Syndrome, MERS, and the Severe Acute Respiratory Syndrome, or SARS. A novel coronavirus is a new strain of coronavirus that has not previously been identified in humans. Coronaviruses are zoonotic, meaning that they are transmitted between animals and people. Detailed investigations have found that SARS coronavirus was transmitted from civet cats to humans, and MERS coronavirus was transmitted between dromedary camels and humans. Several known coronaviruses are circulating in animals that have not yet infected humans. Not yet, at least anyway. However, although they are from the same family, SARS and COVID-19 are not the same. The virus that causes COVID-19 and the virus that caused the outbreak of SARS, or Severe Acute Respiratory Syndrome, in 2003 are related to each other genetically, but the diseases that they cause are quite different. In particular, SARS was more deadly but much less infectious than COVID-19. In other words, it was much harder to get, but it was way more likely to kill you if you got it. There have been no outbreaks of SARS anywhere in the world since 2003. And for that, we can be thankful. How was the coronavirus named? Official names have been announced for the virus responsible for COVID-19, previously known as the 2019 novel coronavirus, and the disease that it causes. The official name for the disease is the coronavirus disease, or COVID-19. The official name of the virus is Severe Acute Respiratory Syndrome Coronavirus number 2. In general, viruses are named based on their genetic structure to facilitate the development of diagnostic tests, vaccines, and medicines. Virologists and the wider scientific community do this work. So viruses are named by the International Committee on Taxonomy of Viruses, or ICTV. Diseases are named to enable discussion on disease prevention, spread, transmissibility, severity, and treatment. Human disease preparedness and response is the World Health Organization's role. So diseases are officially named by the World Health Organization in the International Classification of Diseases, or ICD. How is COVID-19 spread? The virus was first detected in Wuhan City, Hubei Province, China. The first infections are linked to a live animal market, but the virus is now spreading from person to person. It's important to point out that person-to-person spread can happen on a continuum. Some viruses, like the measles, are highly contagious, while other viruses are much less so. The virus that causes COVID-19 seems to be spreading easily and sustainably in the community in some affected geographic areas. This is what's known as community spread. Community spreads means people have been infected with the virus in a specific area, including some that are not sure how or where they became infected. In other words, those people didn't travel or didn't apparently have any contact with other people who may have traveled from areas where the virus was present. People can catch COVID-19 from others who have the virus. The disease can spread from person to person through small droplets from the nose or mouth, which are spread when a person with COVID-19 coughs or exhales. These droplets land on objects and surfaces around the person. Other people then catch COVID-19 by touching these objects or surfaces, and then touching their eyes, nose, or mouth. A fomite is any inanimate object that, when contaminated with or exposed to infectious agents, can transfer disease to a new host. For humans, skin cells, hair, clothing, and bedding are common sources of contamination of fomites. People can also catch COVID-19 if they breathe in droplets from a person who coughs or exhales droplets. This is why it is important for people to stay more than 3 feet or 1 meter away from a person who is sick. Studies to date suggest that the virus that causes COVID-19 is mainly transmitted through contact with respiratory droplets rather than through the air. The World Health Organization is assessing ongoing research on the ways COVID-19 is spread and will continue to share updated findings when they become available. Can COVID-19 be caught from someone who has no symptoms? The main way the disease spreads is through respiratory droplets expelled by someone who is coughing. The risk of catching COVID-19 from someone with no symptoms at all is very low. However, many people with COVID-19 experience only very mild symptoms. This is particularly true at the early stages of the disease. It is therefore possible to catch COVID-19 from someone who has, for example, just a mild cough and does not feel ill. The World Health Organization is assessing ongoing research on the period of transmission of COVID-19, and they'll share these updates as they become available as well. Can someone who is being quarantined for COVID-19 spread the disease to others? Quarantine means separating a person or a group of people who have been exposed to a contagious disease but have not yet developed illness or symptoms from others who have not yet been exposed, in order to prevent the possible spread of that disease. Quarantine is usually established for the incubation period of the communicable disease, which is the span of time during which people have developed illness after exposure. For COVID-19, the period of quarantine is 14 days from the last date of exposure, because 14 days is the longest incubation period seen for similar coronaviruses. Therefore, someone who has been released from COVID-19 quarantine is not considered a risk for spreading the virus to others because they have not developed the illness during the incubation period. Should I worry about COVID-19? Illness due to COVID-19 infection is generally mild, especially for children and young adults. However, it can cause serious illness. Approximately 1 in every 5 that catches it will require hospital care. It is therefore quite normal for people to worry about how the COVID-19 outbreak will affect them and their loved ones. Our best course of action is to channel our concerns into actions to protect ourselves, our loved ones, and our communities. First among these actions is regular and thorough hand washing and good respiratory hygiene. You can check the CDC and the World Health Organization websites for what is the best way in which to do that. Secondly, we can keep informed and follow the advice of local health authorities, including any restrictions that may be put in place on travel, movement, and gatherings of large groups of people. How likely am I to catch COVID-19? The risk depends on where you are and, more specifically, whether there is an outbreak of COVID-19 unfolding in that area. For most people in most locations, the risk of catching COVID-19 is still relatively low. However, there are now places around the world, both cities or areas, where the disease is spreading and spreading quickly. Obviously, for people living in those areas or visiting those areas, the risk of catching COVID-19 is substantially higher. At this moment, both governments and health authorities are taking vigorous action every time a new case of COVID-19 is identified. You can do your part by making sure to comply with any local restrictions on travel, movement, or large gatherings of people. Consequently, this is why many forms of entertainment, sports gatherings, and schools have been either canceled or closed. Cooperating with disease control efforts will reduce your risk of catching or spreading COVID-19. COVID-19 outbreaks can be contained and transmission stopped, as has been done in China now and some other countries. Unfortunately, new outbreaks can emerge rapidly. It's important to be aware of the situation where you go or intend to go. The World Health Organization publishes daily updates on the COVID-19 situation worldwide. So what are the symptoms of COVID-19? The most common symptoms of COVID-19 are fever, tiredness, and dry cough. Some patients may have aches and pains, nasal congestion, a runny nose, sore throat, or diarrhea. These symptoms are usually mild and begin gradually. Some people become infected but don't develop any symptoms and don't feel unwell at all. Most people, approximately 80% or so, recover from the disease without needing any special treatment. 1 out of every 5 or 1 out of every 6 people who gets COVID-19 becomes seriously ill and develops difficulty breathing. Older people and those with underlying medical problems like high blood pressure, heart problems, or diabetes are more likely to develop serious illness. People with fever, cough, and difficulty breathing should seek medical attention. Should you be tested for COVID-19? If you develop symptoms such as fever, cough, and/or difficulty breathing, and have been in close contact with a person known to have COVID-19 or have recently traveled from an area with ongoing spread of COVID-19, stay home and call your healthcare provider. Older patients and individuals who have severe underlying medical conditions or who are immunocompromised should contact their healthcare provider early, even if their illness is mild. If you have severe symptoms such as persistent pain or pressure in the chest, new confusion or an inability to arouse, or bluish lips or face, contact your healthcare provider or emergency room and seek care immediately. Can a person test negative and then later test positive for COVID-19? Using the CDC developed diagnostic test, a negative test result means that the virus that causes COVID-19 was not found in the person's sample. In the early stages of the infection, it is possible that the virus will not be detected. For COVID-19, a negative test result for a sample collected while a person has symptoms likely means that the COVID-19 virus is not causing their current illness. And this is why it is important to wait until you have symptoms before you are tested. With a limited number of testing kits available, we want to make sure that we save the test for the people from whom we might get a more accurate result. How long is the incubation period for COVID-19? The incubation period means the time between catching the virus and beginning to have symptoms of the disease. Most estimates of the incubation period of COVID-19 range from 1 to 14 days, but most commonly around 5 days. These estimates will be updated and refined as more data becomes available. How long does the virus survive on surfaces? It is not certain how long the virus that causes COVID-19 survives on surfaces, but it seems to behave like other coronaviruses. Studies suggest that coronaviruses, including preliminary information on the COVID-19 virus, may persist on surfaces for a few hours or up to several days. This may vary under different conditions. For example, the type of surface, the temperature, or the humidity of the environment. If you think a surface may be infected, clean it with a simple disinfectant to kill the virus and protect yourself and others. Most standard household disinfectants will suffice. The CDC and the World Health Organization have provided a list of household cleaners which are known to kill the coronavirus. and I'll provide a link to that document in the description down below. After cleaning surfaces, be sure to clean your hands with an alcohol-based hand rub or wash them with soap and water. Avoid touching your eyes, nose, and mouth. Can COVID-19 be spread through food? Coronaviruses are generally thought to spread from person to person through respiratory droplets. Currently, there is no evidence to support transmission of COVID-19 associated with food. Before preparing or eating food, it is always important to wash your hands with soap and water for 20 seconds for general food safety. Throughout the day, wash your hands after blowing your nose, coughing or sneezing, or going to the washroom. In general, because of poor survivability of the coronaviruses on surfaces, there is very likely low risk of spread from food products or packaging that are shipped over a period of days or weeks at ambient, refrigerated, or frozen temperatures. Will the warm weather stop the spread of COVID-19? It is not known whether weather and temperature impact the spread of COVID-19. Some other viruses, like the common cold and the flu, spread more during the cold weather months, but that does not mean it is impossible to become sick with these viruses during the other months of the year. At this time, it is not known whether the spread of COVID-19 will decrease when the weather becomes warmer. There is much more to learn about the transmissibility, severity, and the other features that are associated with COVID-19, and investigations are still ongoing. So, who is at risk of developing severe illness? While we are still learning about how COVID-19 affects people, older persons and persons with pre-existing medical conditions, such as high blood pressure, heart disease, lung disease, cancer, or diabetes, appear to develop serious illness more often than do others. If you are somebody who is at a higher risk of getting sick from COVID-19, there are a few things that you can do. You should stock up on supplies in the event that you need to quarantine yourself or keep yourself apart from others. You should take everyday precautions to keep space between yourself and others. In particular, when you are out in public, keep away from others who are sick. Limit close contact and wash your hands often. All parts of your hand, wrist, and fingers. Avoid crowds, cruise travel, and non-essential travel. If there is an outbreak in your community, stay at home as much as possible. Watch for symptoms and emergency signs. And of course, if you do get sick, stay home and call the doctor. Don't go to the doctor's office or the emergency department, where you could potentially become infected if you were not already infected, or where you could potentially infect others were you already infected. Are there any medicines or therapies that can prevent or cure COVID-19? While some Western, traditional, or home remedies may provide comfort and alleviate the symptoms of COVID-19, there is no evidence that current medicine can prevent or cure the disease. The World Health Organization does not recommend self-medication with any medications, including antibiotics, as a prevention or a cure for COVID-19. However, there are several ongoing clinical trials that include both Western and traditional medicines. The World Health Organization will continue to provide information that is updated as soon as clinical findings are available. Are antibiotics effective in preventing or treating COVID-19? They are not. Antibiotics do not work against viruses. They only work on bacterial infections, which this is not. Antibiotics do not work. They should only be used as directed by a physician to treat a bacterial infection. Is there currently a vaccine, drug, or treatment for COVID-19? Not yet. To date, there is no vaccine and no specific antiviral medicine to prevent or treat COVID-19. However, those affected should receive care to relieve their symptoms. People with serious illnesses should also be hospitalized. Most patients recover thanks to supportive care. Possible vaccines and some specific drug treatments are currently under investigation. Currently, the most effective ways to protect yourself and others against COVID-19 are to frequently clean your hands, cover your cough with the bend of your elbow or a tissue, and maintain a distance of at least 1 meter or 3 feet from people who are coughing or sneezing. Should I wear a mask to protect myself? Only wear a mask if you are ill with COVID-19 symptoms, especially coughing, or you are looking after someone who may have COVID-19. Disposable face masks can only be used once. If you are not ill or looking after someone who is ill, then you are wasting a mask. I repeat, wasting a mask. There is a worldwide shortage of masks. So the World Health Organization urges people to use masks wisely. It's important to point out that masks are effective only when used in combination with frequent hand cleaning with an alcohol-based hand rub or soap and water. And more importantly, if you wear a mask, then you must know how to use it and dispose of it properly, which most people do not. Fortunately, the World Health Organization and the CDC have provided information on how to do this. I'll provide a link to that document down below in the description. Are there specific protection measures for persons who have been in or who have recently visited over the past 14 days areas where COVID-19 is spreading? Stay at home if you feel unwell, even with mild symptoms such as a headache, slight runny nose, until you recover. Avoiding contact with others and visits to medical facilities will allow these facilities to operate more effectively and help to protect you and others from possible COVID-19 and other viruses. So while this is not everything there is to know about COVID-19, this is a basic summary of all of the important information that can help to keep you and the others around you safe from the COVID-19 virus. As always, that's been a word from Dr. Chris, not your everyday ortho.